Thank you very much. Is my screen visible?
Yes, it would be good if you can just make your full screen.
Yes, I'm trying to do it. Okay. Is it working?
Yes, yes, it is working.
Okay. Yes. Okay. So thank you very much for this, for inviting me in this extremely interesting session. I'm especially thankful to Dr. Ram Manohar and Dr. Patwardhan, who organized and who are guiding us into this conversation. The topic I will deal with is, of course, related to my own experience, and it is based on my personal view of the importance of looking for stronger connections between Ayurveda and scientific psychology. In this sense, I mean modern psychology based on research instruments which are reliable, validated, and usable across populations. Why do I feel that this dialogue is important to promote health? Because already in the Western medicine, there is a growing attention to the role of the mind in promoting health at any age. Just to show you here, we have two very recent papers published in the last 2 years, showing that positive mental conditions, these two papers focus on two different dimensions, like perception of meaning and purpose in life, and on the other side, an optimistic view in the future, are associated with, even in longitudinal perspective, with longevity and health. This shows that we are finally aware in the West, and we can measure the positive role of mental health on life functioning and physical health. This is even more important today because we are facing around the world, across all countries, this paradox in which we see the increase in life expectancy, but also the increase in number of years lived with some kind of chronic or progressive disease. People live longer, but they are also affected by diseases which cannot be cured, cannot be healed. They can just be treated in terms of maintenance and prevention, secondary and tertiary prevention. And this means that people, an increasing percentage of people around the globe need to be supported and accompanied in living with chronic diseases. From little children who are now surviving to very problematic congenital and genetic diseases. We just got, for example, today the announcement that in Italy, treatment for a specific kind of spinal motor atrophy, the worst one, the one leading to death children in between 18 and 24 months of life, is now available and provided for free treatment to the families of these children. But of course, this is not a complete solution. These children must be followed for the rest of their life. This also, this approach calls for paying attention to the multi-componential nature of health. Health is not just biology, biological structures and physical functioning, but it is also activities, daily life activities, and involvement in social and community environment, as well as some personal dimensions that are not very well classified in this international classification of functioning proposed by the WHO, but which are basically referring to cognitive processes and psychological dimensions. And already since 40 years, there is an effort in medical schools to teach students to collect data, anamnestic data from patients, taking a biopsychosocial perspective. That is collecting information not just about their biological conditions, but also their psychological condition. That does not only mean being depressed or anxious or experiencing some kind of severe mental health disorders, but means also perceiving resources, perceiving challenges in daily life, and having some kind of strategy to cope with these challenges. However, even today, this nice, theoretically well-grounded model is rarely practiced in the daily activities of doctors, especially in the hospital context. On the other side, there is also an increasing amount of literature showing that it is possible to live with a chronic disease and to experience positive mental health. And like we saw before, being healthy at the mental level helps keeping healthy at the physiological level. Being healthy at the mental level helps people with chronic disease cope with the disease better and develop mental resources who allow them for even finding benefits in a condition of disease and developing new goals, a good quality of life, and at the same time being able to control the disease more effectively. All these studies, however, are basically grounded into the Western world, and data are basically collected in the Western countries. Moreover, the basic model is the model of conventional Western medicine. All the studies on health psychology prominently refer to positive achievements at the psychological level in people who are treated with conventional medicine. We don't know very much, we know very little about what happens at the psychological level to treatment based on non-conventional medicines, including Ayurveda. Sometimes we also have very interesting findings when Indian practices are applied to Western population. And here I provide you with two very interesting, in my opinion, I was really impressed when I read this paper published very recently about the use of yoga and meditation. The study was very well conducted. It was based on two, let's say, two experimental studies, comparing people practicing yoga on the one side and practicing metta meditation on the other side with control groups, in order to test what happened to them at the psychological level. The expectation was to see that as expected by the practice of yoga and meditation, people should experience a feeling of quietening the ego. So what we know from the basic principles of yoga is that through yoga, ego gets quieter, and the self-centeredness disappears, or at least decreases, and a feeling of larger merging with the environment is promoted and supported. There is, in a way, a control of the mind and a control of the ego. Well, these studies found exactly the opposite. After practice, there was an increase in self-centrality and self-enhancement, both with Hatha Yoga and with Metta meditation. So in 2 samples of adults from Europe, in this case from Germany, but I think we could have found the same findings in other countries in Europe, the outcome of practicing yoga and meditation was to be more strongly self-centered and feeling stronger, feeling better, feeling more skilled, feeling better performing. This is interesting because it is an example of how we can apply Indian practices, misunderstanding their basic message. We cannot deny that the basic outcome of this self-enhancement was well-being. Measures of well-being like feeling increased self-esteem or increased feeling of life satisfaction were present at the end of these 2 studies. But at the same time, this is not the main goal of yoga or meditation. So since mindfulness, for example, the practice of mindfulness and yoga are so widespread in the West, it is interesting and it is important to take into account the use made of these practices in other cultural contexts, because of course there is a need to adapt and to flexibly adapt some practice to the context, and this is also something that Ayurveda acknowledges, but at the same time the goal can be totally different at the end, and this possibility should be taken into account. Another interesting finding can be derived from some apps that are available in the web to help people practice meditation. I just focused on 2 of them, like this Headspace, that helps people meditate by downloading an app and giving the person a schedule to meditate every day. What is interesting is that the effort to keep the pace and to meditate every day becomes a kind of race. People are just competing. Who is able to meditate uninterruptedly for so many days, not breaking the day series, the sequence of days without interruption in meditation? And here we could also wonder, is this meditation? Is this effort to show in an app that I am good in meditation really the goal of meditation? So, and this is the same across different websites and different apps that are available to people around the world to promote meditation. So this is the use of mental practices in the West. Of course, this is not necessarily the only use, but it is a quite widespread use. On the other side, Ayurveda states since several thousands of years that this is a mind-body imbalance. And the fact that we now in the West acknowledge that the disease is a mind-body imbalance has been considered a recent achievement in the progress of Western medicine, but of course it was a basic tenets of Ayurveda. And interestingly, what has always impressed me in Ayurveda is that the primary causes of imbalance are found in the mind. And this is something we have identified more and more frequently in, let's say, at least disease progression and disease management in people with chronic disease, even in the West. And the idea of balance is the core of Ayurveda, but at the same time, it is not a stranger to Western thought. For example, in ancient Greece, the concept of sophrosyne refers to mental health as self-control, as mind balance, which is interestingly opposed to hubris, which means pride, and which seems very similar to the concept of self-enhancement that has been found as an outcome of yoga and meditation in the European study I mentioned before. So we are struggling in the West between what do we mean with self-control and what do we mean with self-enhancement. And it is interesting to try to understand how these two phases of mental health are influencing physical health. Another aspect that has been taken into account in the West recently, and that is on the other side well known in Ayurveda, is the issue of daily behavior, dinacharya, adopting an appropriate pattern of activities, health behaviors, diet, and some kind of physical activity in order to promote health. We have now awareness of the importance of healthy behaviors. For example, in this study on cancer survivors, or the role of positive affect in promoting adherence to treatment. So more and more findings in Western medicine show that the mind is a core trigger promoting either health or disease in daily life. We, however, have to deal with an issue which could be interesting to be explored in Ayurveda as well, the issue of adherence. In WHO in 2003 highlighted that between, on average, 50% of people adhere to treatment, regardless of the fact that this treatment has to be paid or it is provided for free. There is no difference in terms of access to treatment. And this is an alarming message, because 50% of treatment adherence or non-adherence means that there is a lot of waste of public health resources and a worsening of health conditions due to non-adherence, which is very often related to individual motivation on one side, and physician inability to properly communicate with patients. So the burden is not only on the patient, but it is also sometimes, and 50-50, recent studies show, on the physician. Adherence, of course, is more crucial for prolonged treatment, like treatment for chronic disease or for multiple treatments in people with multiple pathologies. But at the same time, there is this is a very alarming issue, because in spite of this alarm made by WHO in 2003, now after 20 years, basically nothing has changed, despite a number of publications that have been produced about treatment adherence. Here we have a recent Cochrane review on this topic. And adherence involves not just taking tablets, which is the easiest behavior required to patient, but it prominently involves, or at least also involves, physical treatments, diets, other behaviors that must be implemented every day. And to this purpose, I am wondering whether I could not find very specific studies in Ayurveda tackling these topics, which I think are crucial also for Ayurvedic doctors to better understand what is happening to patients once they leave, for example, the hospitals. Ayurvedic treatments imply a very massive treatment, for example, for 2-3 weeks or for even more, but then people go home. What happens when they go home? Or what happens to outpatients? Do we have data on their adherence to treatment? This is interesting to explore, also to promote and to favor both patient adherence in India, but also in other countries, and also to provide objective data of the outcomes of the treatment. Because if we are not sure that patients are adhering to treatment properly, how can we be sure about, for example, the physiological outcomes we are measuring? And it could be very interesting, since now in health psychology we have a set of interesting research instruments available to measure the psychological outcomes of any kind of treatment. It could be interesting to add to the measure of physiological outcomes in Ayurveda also some measures of psychological outcomes, which in some cases could be more satisfactorily than the physiological outcomes for the doctor, but at the same time could play an important role based on this continuous interplay between physical and mental health. We can also think about assessing patient conditions when from a more strictly biopsychosocial perspective when physicians meet the patient. So besides paying attention to aspects like the typical measures performed for Ayurveda anamnesis and patient evaluation, the addition of some kind of validated and reliable measures of quality of life, of psychological well-being and mental conditions could help orient the doctor towards some kind of potential treatment outcome. And also taking into account the habits and the social and community environment could play an interesting role to evaluate the patient condition and also to predict the outcomes of the treatment in a certain measure. So I think the amount of areas in which the sound applying proper instruments derived from psychology and including them in the Ayurvedic evaluation could play an interesting role in order to promote sustainable well-being, which is actually the aim of any kind of medical intervention. We are aware we must be humble enough and say that we are not able to cure most of the disease we are facing today. We can only handle them towards chronicity and a positive quality of life. And in order to improve this side, we cannot only stop at the physical level.
Madam, excuse me. We have 5 more minutes to go. This is
Thank you.
Gentle reminder. Yeah, thank you. Thank you.
Sorry, I would like to, okay.
You had 5 more minutes.
You have 5 more minutes.
Oh, I see.
Yeah. Yeah. Sorry for the confusion. Yeah.
No, then I will just share my last slide, which comes from a Western poet, Thomas Sterne Eliot, who is, was, however, one of the most relevant poets in the Western literature in 20th century, and who wrote a very nice compositions trying to integrate the Indian view of cyclical view of time with the Western linear view of time. He was really trying to provide a universal view of human condition. And this is a message that I think is very important. He conveyed to everybody of us, thinking about the destiny of human beings to build, compared to the rest of the nature, to the inanimate nature, to the animals and birds who are busy in living in harmony with the universe in an immediate way. We human beings must build. We have a kind of intrinsic, it is a kind of intrinsic destiny to build knowledge, to build understanding, to build bridges between cultures and between different views of the world. And I think these efforts we are doing here are well aligned with this condition. Thank you.